Reach vaccination clinic along with their partners at GRMC. Good morning, Janella.
Hi, good morning, Chris. Good morning, Bree. Good morning, Jason.
Good morning.
Thanks for having me.
Of course. So let's just get right into it. When is the Vax clinic? And I know you were telling me that you filled up a bunch of the slots, right? So I guess the messaging is getting out to where it needs to go, right?
Yes, definitely. Yeah. So we had a pre-registration drive this past Sunday, and it was pretty successful. But what I really want to do is just give credit to where credit is due, and introduce. Of course, GRMC is here with me, Charlie Laron. I also want to introduce Dr. Dolores Lee, who's been instrumental in this process, and Joelle Setic, who's with the Micronesian Resource Center, and who's also with Manyelu. And without our partners, this would not have been successful, or even happening. So I just really want to give them all the credit. So I actually want to give them the floor, because they're really the ones who's making this happening. So if Joelle wants to talk, or Dr. Dolores Lee or Charlie wants to talk about this project, by all means, please help me out here.
Go on. I guess we can start with go ahead, Joel.
Yeah, so I'll just do the introduction of the whole vaccination and the whole project and initiative, and I'll give it to the doctors and the partners to kind of talk about the logistics and everything else. On behalf of the community network and the FSM Association, along with the other partners from the nonprofit organization like ourselves, Micronesian Resource Center, and then the group within the FSM community, the FAS community, I want to thank these folks for their hard work and dedication that make this vaccination and initiative possible. So the vaccination is on Sunday. This is one of the first of many pods. It'll be happening at the Terito Center right across of the Santa Barbara Church. And we pick on Sunday because it's a Palm Sunday, and it's also when there's a lot of people from the FAS that will be going to church at this certain time. So we pick this spot to make it convenient for them as they go to church, and then at the same time they finish and they can come and get their vaccination. And this initiative is fueled and motivated because of this group with the FSM Association and the community network, because we see that there is a need to vaccinate our brothers and sisters from the FAS, since they have one of the lowest vaccination results coming in with all the data from the Department of Public Health. And we really want to help our brothers and sisters and get themselves protected, get their families protected, and within the community. So I'll hand the floor over to Dr. Lee to kind of talk more about the vaccination and everything else. But yeah, we want to invite the FSM community, the FAS community. There will be other pods coming soon. So if you want more information, please feel free to contact. You can contact the FSM consulate office, or you can contact our office at the Micronesian Resource Center at 686-2227, and we can offer you more information on the upcoming pods. Thank you.
Dr. Lee?
Hi, good morning. Buenas. I'm very happy to be here with all of you. Thank you for the opportunity. As Janella and Joelle both shared in terms of we have a vaccination clinic planned for Sunday. And it's not our first, but it's, we hope and anticipate that we will have many more pods until we can get the full participation of the FSM FAS community. As you know, vaccines are a preventative measure. This is a step we can take before people get sick. We really do believe that the COVID vaccines are our best chance to curb the pandemic that we're currently experiencing. And that's just along the lines in terms of what everyone is trying to do now. As you know, we dropped the vaccination age in terms of eligibility requirements down to age 16. And so, public health and all of our community partners, we are all very intent on getting as much of the population vaccinated as soon as possible, because every day that you're not vaccinated is just another day where there's a possibility that you are at risk of getting infected and suffering from a severe COVID infection that could result in hospitalization or even long-term complications and even sadly death. So we're trying to get everyone on board and trying to get everyone vaccinated as soon as possible. We're very confident in these vaccines and in their effectiveness in terms of preventing severe illness from COVID-19. And so we're really just very excited that we have the opportunity and that we're able to do this for the community. Thank you.
Charlie?
Yes, we're, our role here at GRMC is really to help wherever we can, especially with vaccinating our community. This will be our third vaccination outreach for the FSM FAS community, but this will be the first where we're going out outside of the hospital. And our initial goal was 150. We are surpassing that number very quickly, and really that is at the help of all of the FSM leaders and the community individuals that have gone out. Even Janella went out on the weekend to help pre-register and get information out and education out to the FSM FAS community to let them know that this is important. We are here. We are coming to you, and this is what we can do to combat the coronavirus. So we're excited to take part in this, and we're here to help out whenever public health and the community needs us to help.
Joel, I know that the conversation has been that, the FSM communities, like you said, one of the lowest vaccination rates, but with the response that you got for this latest Vax Pod, it kind of seems like you guys might have turned the corner. What messaging or what happened, do you think, to kind of to change that mindset?
I'm so sorry. Can you repeat the question one more time? I can't really hear.
So I know you said that the FSM communities have one of the lowest vaccination rates, but from what Janella was saying, it looks like the turnout for this Vax Pod was really good. What do you think has changed? Is it just a matter of like getting the message out to the communities?
Yeah, so it's also the matter from getting the message out, and then also spreading the awareness and the education about the vaccine. There's a lot of stigma within the community where they think that the vaccine, it's bad, or there's a lot of negative things about the vaccine. So it's just a matter of maybe misunderstanding or miscommunicating. They might got their other messages or information from the certain website or internet that may not have good support or good proof. So with the help of the doctors, we had conversation within the community or with the leaders, and then we stream these lives or even give out flyers about the whole vaccine. So it's just a matter of spreading the information, the right information, and inviting people to come in, because everybody wants to go back to normalcy. So this is one of the best ways to go back to normalcy, is to get everybody protected and everybody vaccinated.
Janelle, I wanted to ask, so with this outreach, right, you guys, and throughout the pandemic, there's been different outreaches, whether it's for testing or vaccinations, right? But the FSM community, as well as other communities on Guam, it's not just COVID that we're at risk of. I mean, there are just many other illnesses, diseases, from diabetes on and on and on, right? All these conditions that we hear make people more susceptible to succumbing to COVID. So in like forging these kind of like new and maybe even strengthening existing relationships moving forward as we crawl out of this pandemic, do you think that it's going to be easier for public health to do other types of outreaches within the FSM community, since we've kind of established this relationship because of COVID?
Actually, I think that's a great point that you make, Chris. One of the things that we want to do with the FSM community, we realize that the COVID-19 pandemic has created many challenges, and not just within the FSM community, but for the entire community, the entire island of Guam. But we want to look at the COVID-19 pandemic as not the end-all be-all, but just the first step in forging this partnership with our brothers and sisters within the FSM FAS community, because we do offer testing and COVID-19 vaccination, but continuing on beyond the COVID-19 pandemic testing and vaccination, we also want to see if we can continue with other social services, such as other immunization programs, perhaps partner with, like for example, DOL, to see if we can educate them about job opportunities, GURA for housing projects. So this is not just a end all be all type of thing. It's not a one-off endeavor. So we want to create partnerships with them, like for example, with the Micronesia Resource Center, other nonprofit organizations, so that this is a long-term opportunity, a long-term project initiative, so that this partnership goes on for a long time, because we want our brothers and sisters to be self-sustaining. We want this to be a meaningful relationship. And so that's something that we've discussed. We've been meeting regularly for the last several weeks. And so, and this is actually based off of a national working group. And this is the same thing that they repeat, that, this is not something that you look at and it's just about COVID-19. This is something that needs to be approached from a holistic point of view. So that's a great point that you make, because we don't want it just to be about the COVID-19 pandemic. We want it to be about, their entire lives.
Thank you for that, Janella. I guess in closing, how many slots are left, and how can people avail of those last few slots? And then are you planning another outreach down the road?
Yeah, so like Charlie mentioned, initially we had planned for 150 doses, but when we did our initial outreach for the pre-registration drive this past Sunday, those slots filled up quickly. So we did come back to the table at Public Health, and we decided we're going to increase the number of doses. And so to account, especially for walk-ins, because this coming Sunday is a Palm Sunday. So we realize that there's probably going to be a lot more parishioners that are going to be attending church. And so we've increased the number of doses to 300 doses. But we don't like turning people away. We really dislike doing that. And as much as possible, we're going to take as many people who show up to the mini pod, the mini vaccination clinic this coming Sunday. But if we happen to run out of doses and more people continue to show up, we're going to take the names of those who come and plan for future pods, as everybody here has mentioned. So this is not a one-time deal. GRMC has held vaccination clinics for the FSM community. So we're going to continue to plan for more. Another partner that's involved that we have not mentioned yet is AMC. So they have a mobile van that I believe Triple J has donated to them. So they're another partner that we're also planning future pods with. And so, and that's a van that's capable of going out into the community as well. So if anything, we have the capability of going out to the neighborhoods, to the areas, and bringing the vaccines to them. So, we do plan for more. And so we're really hoping that we can, and the other thing too is, it's not that we want to limit ourselves to just 300. It's really about resources, manpower, the capacity within the building, at the Daddy Doe Senior Center. I mean, if we could do 500, if we could do 1,000 that day, we really would. But really, it's about resources and capacity. So, so it's I printed out the flyers. I don't know if you can see it.
Yeah.
And I sent it to Chris.
Thank you.
But it's this coming Sunday, 2 to 5 p.m. On the flyer, it says 150 doses, but we did put subject to change because we had a feeling that we would, get a lot of interest. But it is up to 300 doses. So 2 to 5 p.m. Right across the church, so Sunday, March 28th. And it's at the Daddy Doe Senior Center, once again, right next to the mayor's office.
Thank you, Janella. Thank you, ladies. Joel, thank you.
Thank you. And again, shout out to the FSM community, the FSM consulate office. Really, my hats off to them. They've done all the, the groundwork. They've been partners. They've been co-leaders, actually. I want to say not just partners, but they've been instrumental in this process. So I really want to give them the credit for this.
Thank you. And we'll see you guys. Keep us posted on the next one. We'll help get the word out. It's 9:27. We're going to take a break and be back with more of The Link next.
Make it through the week with Monday's Work Week
When we
Weather.
throw things away, where is away? What happens to our waste, and where does it go? As a community of small islands, the waste crisis is a large issue we want to bring into focus. Micronesia Climate Change Alliance presents From Our Nanas for Our